COVID-19 cases in Kenya, the highest number of cases to be registered since the first case was announced nearly 2 months ago. Now, the new cases are without a doubt a clear indication that things are not getting better in the country. These cases have been shooting up from last week when the government started undertaking mass testing in Nairobi's Kawangware and of course Eastleigh estates as well as in Mombasa County. But just what is it that we are not doing right? The Ministry of Health is raising concerns over the don't care attitude exuded by some of the Kenyans, including ignoring government directives. But the citizens are also asking how effective are these directives are they in towards ensuring that they tame the pandemic, and how do they survive the present and post-COVID-19 tough economic times? So tonight our guest wears several hats. She is the woman representative for Murang'a County and the chair of the Parliamentary Health Committee, Honorable Sabina Wanjiru Shege. She probably has answers to our questions and those of the women of Murang'a County. So start sending your questions. The hashtag is PledgeWatch. The SMS short code is running down on your screen and you can drop those comments and let's get to hear what you have in terms of a question for her. My name is Linda Alela. First, we take a look at the headlines. Eastleigh Estate in Nairobi records 29 COVID-19 cases as the country confirms 45 new cases, the highest number in a single day in Kenya so far. Kenyans continue to exude a don't care attitude, even as newly daily COVID-19 cases stay above 25 for the fourth consecutive day. And Wajir County could soon be isolated like Mandera after it recorded 5 new cases of COVID-19, all from people with recent history of travel to Somalia. Welcome back. My name is Linda Alela. The sign language interpreter is Ann Y. Rimu. And let's kick start as, of course, we are far from normal. The Cabinet Secretary for Health, Mutahi Kagwe, has said today while announcing the highest number of COVID-19 cases recorded in the country in 24 hours. Kenya's number of COVID-19 cases has now surpassed the 500 mark after 45 new cases were recorded, majority of them in Eastleigh, Nairobi. And of course, to kickstart our bulletin tonight is Tracy Mukami.
Some 45 people have turned positive. This, of course, is the highest number recorded in 24 hours ever since the first case on the 12th of March. Out of this number, 29 are from Nairobi, 11 are from Mombasa, while 5 are from Wajir.
45. This is the highest number of COVID-19 cases that Kenya has recorded in a single day since the onset of the disease in Kenya nearly 2 months ago. The pronouncement brings the total number of COVID-19 cases in Kenya to 535. The spotlight is now on Eastleigh and Old Town Mombasa, where the bulk of these cases are concentrated.
The first one is Eastleigh. The 29 cases that you have heard which are from Nairobi are all from Eastleigh. That means that as we speak, there are 63 cases within the Eastleigh area alone.
Even with a spike of COVID-19 cases, Kenyans are still unperturbed, and the Health CS warns that defiant Kenyans will face the full wrath of the law.
I just said earlier that this intervention was supposed to secure some form of livelihood for some people, even as we observe the measures that we have taken. And it is true that it has been abused. It is a fact of life that people have been going to pubs or to eateries. They order one sausage with 2 beers. They eat that one sausage. Anakula hiyo sausage moja na bia mbili. Anatoka hapo. Anaingia hoteli ingine. Huko anakula bia mbili ingine na sausage ingine moja. Anaingia ingine. Anauliza chungwa, risasa ni dessert.
The numbers announced on Monday trashed the hope that many Kenyans had to reopen business, with Mutahi urging Kenyans not to resume their pre-COVID-19 routines. In a sigh of relief, no health worker has tested positive for COVID-19 in the last 2 weeks, and the government says it is devising new measures to stop the spread of the virus in the areas listed as hotspots.
And somehow, somewhere along the line, we seem to have come to the conclusion as a society that things have gone back to normal. Today's figures show things are far, far from normal. Things are very challenging.
The coronavirus pandemic continues to ravage the world, with over 3.5 million cases worldwide, over 1 million recoveries, and the death toll standing at 252,000. Tracy Mokami, TV47, Nairobi.
And the disobedience of Kenyans in following government directive has led to an increase in the number of new COVID-19 cases daily, from imported positive cases to local transmissions. It seems the residents in areas listed as hotspot are blind to the consequences, or they just don't care. Joash Ansari reports.
The spread of COVID-19 has been associated with close contact between humans. In Kenya, it has been noted that Kenyans are not following the laid down measures to combat its spread, like wearing masks and keeping social distance. In Kangemi Market in Nairobi and in different matatu terminal, the situation is dire. No mask, no social distance, and hand sanitizers are by the way and the norm. Some of the people we talked to are of the view that chiefs and ward administrators have a role to play in creating awareness and leading the residents in implementing COVID-19 precautionary measures.
Chief anazunguka katika eneo la mahali anapofanyia kazi na kuangalia vile wananchi walio chini ya mamlaka yake wanaofanya. Ingekuwa la muhimu sana, lakini kama wananchi hawataona wale wanaowasimamia wakisunguka kufanya hili na lile, wataona haya mambo kama ni mambo yasiyo na hatari.
On the other hand, there are those who are cautious in following to the latter measures put in place by the government that are aimed at flattening the curve.
Lazima customer kiingia kwenda mask, customer kiingia lazima sanitize kwanza, alafu ndaingia hapa panguze na akae kidogo, lakini si wengi, lazima keep distance kwanza.
Wasema wajaribu kuoga mikono sana na sanitize na kuweka mask. Ndio hii kitu tuone vile itaenda.
Wasitembee pale na pale, wakae tu nyumbani mahali wako na wanawe mikono kila wakati, wavae mask wanapotoka nje ili tuepuke na hii hatari ya magonjwa.
In Kenya, being a country immersed in Christianity, some people believe through dedication to religion, the coronavirus pandemic will be defeated.
Kenya ni watu ambao wanapendwa na Mungu. Na kama raiti wangejua vile upendo wa Mungu wanapendwa, wageukie Mungu, waachane na maovu na chukizo na wanyenyekee kwa Mungu, ili hii academic iweze kutuondokea. Hakuna mambo mengine.
Joash Onsare, TV47 Nairobi.
Well, thank you, Joash, for that story. Due to the fear of possible rapid spread of coronavirus in densely populated areas, the government announced key measures for distribution of relief food and other necessities, as well as encouraging the residents to observe social distance guidelines as a way of ensuring safety. Our reporter Calvin Chitwa explores how the regulations and entire exercise spearheaded by the government officials is administered in vis-a-vis similar exercises by the politicians.
Even after the government barred politicians from directly distributing relief food and personal protective equipment to densely populated areas without focusing on individual need cases or handing them to administrators at grassroots level for the distribution to be done in an organized manner, the trend still continues in many parts. Already, the national government, through county commissioners, directed chiefs through the Nyumba Kumi initiative to identify persons eligible for relief food. During the celebration to mark World Press Freedom Day on Sunday, journalists in Uasin Gishu, in collaboration with the Langas Estate Chief's Office, donated foodstuffs to less fortunate in the area.
Kutembelea baadhi ya familia ambazo tumegundua katika mitaa duni wanaathirika. Baadhi ya kina mama wameachwa na waume zao, na pia kuna wale ambao wanaishi na ulemavu.
Familia nyingi kwa sasa, wanaume ama wale mabwana, wameweza labda kutekeleza majukumu yao na kuachia kina mama.
Among the beneficiaries of this noble gesture by the scribes was Saumu Chelagat, a mother of 3 who had been abandoned by her husband because of the difficult economic times occasioned by the COVID-19 pandemic. Saumu is nursing a 1-month-old infant. She narrates how she has been struggling to raise her child. 1 kilometer away, the chief and his team takes us to Philip Talai, a father of 3 who was crippled by a known disease. He is now paralyzed and can't go to work.
Sema ni ugonjwa unaitwa rheumatoid arthritis. Nila kutibiwa tu na kupona. Lakini sasa nimeshindwa, sina namna.
Kalai has to rely on his wife, who has to do odd jobs to feed the family. The children have not been attending school, and when COVID-19 was reported in the country, the situation became worse for this young family.
Nikienda kuomba kazi, mwalimu tu ananiambia, "Enda uache ulevi, ndio ukuje nitakupea kazi." Lakini si ulevi, nimelemea hata kutembea sasa tembea. Hata kutembea tu nimeshindwa kabisa.
The two families bring a clear picture of the difficulty needy and vulnerable persons are undergoing in the society during the COVID-19 pandemic period. Recently, Keses Member of Parliament Dr. Swarup Mishra donated foodstuffs to 1,000 Muslim families, an exercise that police officers from Eldoret Central Police Station had to disperse crowds that had gathered.
Otherwise, we are going to spread the enemy that intruded to this one. From Epimato, Keptoren, Cargo, then food will reach you there, no problem.
He made the foodstuffs donation at Huda Muslim School and Jamia Mosque in Eldoret town.
So please don't politicize this brotherhood.
And although his gesture was a noble one, it fell short of the set COVID-19 containment measures. Beneficiaries were gathered in a crowd contrary to social distancing rule. And to prevent the danger of infections, police dispersed the crowd. 2 weeks ago, Dr. Swarup Mishra narrowly escaped arrest as the government suspended his plans to distribute relief food to more than 12,000 vulnerable people in his constituency. The Uasin Gishu County Commissioner Abdulrazak Jaldesa and Governor Jackson Mandago said close contacts during the exercise had violated the government's ban on crowds and could spread coronavirus. Calvin Chitwa, TV47, Uasin Gishu County.
Now, the Council of Governors says KEMSA is unable to effectively supply medicines to the 47 counties, and this challenge can lead to deaths. According to Health Chairman in the Council of Governors, Mohammed Kuti, the retrogressive health laws should be looked into to allow a second option for counties in procurement of medical supplies. Take a look.
Kenya Medical Supplies Authority KEMSA has been labelled as the biggest stumbling block towards delivery of healthcare services in the counties. Appearing before the Senate Health Committee led by Senator Mike Ombito, the Council of Governors have expressed their displeasure in the monopoly of KEMSA in medical supplies to the counties, which they say it's too bureaucratic.
Needs, and yet we're not able to procure outside of KEMSA. KEMSA, as far as I'm concerned, does not have the capacity really to supply all the medicines and all the equipment that are needed to provide healthcare in this country of ours. It's a monopoly that is dangerous. When they are delayed, medicines are delayed, it can even lead to the death of people. So that is important to state that it has been our biggest headache.
The issue we have is the law that says if you buy outside KEMSA, then you have broken a law and therefore you are bound for fine or jail or whatever. That needs to be changed so that there should be a second stop shop, and my proposal has always been met.
On the Universal Healthcare Program UHC, which has been a success at the pilot stage in some counties, the governors say financial challenges have been a major drawback for the project.
Success is not standard. That's why the pilot is different for different counties. And in fact, even when we roll out, it will not be 100%. Or if Machakos is 80%, it doesn't mean all the counties will be 100%. I know Kisumu had very special challenge even accessing the UHC money because of the challenge of assembly and the wrangles between the assembly and the executive to pass the funds.
Isiolo Governor Mohamed Kuti told the Senate that effects of the coronavirus pandemic have negatively impacted implementation and intergovernmental partnership agreements entered between several county governments, Ministry of Health.
6 of us again were selected to go and further negotiate with the Ministry of Health. So in terms of consultation and in terms of arriving, we had turned through a lot of issues until about 3 items were left. As I said, issues of KEMSA, the legal aspect of it, issues of doctors. That became an issue where we are paying for doctors who are being trained by national.
Similarly, the county's bosses say UHC program will be derailed due to reduction of financial allocations by 11 billion shillings thanks to the national war against COVID-19 pandemic. Elizabeth Mutuku, TV47 Nairobi.
Well, it's been a bulletin full of COVID-19 cases, and still we proceed to another story in regards to the same. And after the government pledged a package to help people living with disabilities during the coronavirus pandemic, it has now emerged that the money meant to cushion the disabled people in the country is ending up in the wrong pockets, and that the intended recipients are yet to receive any assistance. Elida Gova reports.
Addressing the media Tuesday, Nairobi business community of people living with disabilities chairman Ivan Shitandi lamented that they have not benefited from the cash transfer package since its launch, and now calling upon the government to intervene and ensure that they receive the money.
Lalama ya hii group yetu ni kutopata haki kutoka kwa serikali, na serikali kama hii pesa tunaita cash transfer, rais akitamka mwenyewe akisema walemavu wapate cash transfer, na kuanzia siku ile alisema majina ilichukuliwa na ikachukuliwa kwa wale watu hawana ulemavu. Lakini sasa kwa hiyo muda yote tumekimbisha sana, tumekosa hiyo pesa.
Walemavu kama wenye najua ni wengi sana wenye hawajafikia hii kiwango ya cash transfer. Sana ndio tunataka kujua cash transfer tunao wenye wanafaa kupata na wenye wawetu kupata. Rais alisema vizuri ya kwamba pesa mzee wale wajiwezi, walemavu na wazee. Ndio sababu tunataka kujua walemavu ni wakina nani. Na waomba tu na nawaambia mpaka hata serikali ikisikia, wale watu wenye wanapata hiyo pesa ni wale watu wa jamii. Kama wewe ni mmoja kwa wale watu wenye wanapeana pesa, unapelekea sister yako, unapelekea brother yako, lakini sio mlemavu. Unaona?
Similarly, they are demanding that changes be made to the officials in charge of people living with disabilities, saying that most of them are not disabled and they cannot understand their plight.
Mtu amenunua gari yake, amekimbia vibaya, ameanguka, mguu imefunjika. Huyo tayari ni tajiri. Huyo ndiye amechukuliwa kwa ofisi pale. Ukienda pale, anasema walemavu wanasumbua sana. Huyo ni mlemavu wapi? Walemavu, tafadhali, kama serikali inaweza kubali, inaweza kutukumbuka, ichukue walemavu wa kuzaliwa au wa ugonjwa, mwenye ameumwa ndiye akawa mlemavu, awekwe kwa ofisi, ahudumie sisi walemavu.
They're also calling upon the government to reduce the procedures and guidelines used in registering disabled people and acquisition of the funds, saying they are too cumbersome for them.
Tumeenda kwa chifu, tumeenda kwa DO, tumeenda mpaka kwa county commissioner, hatukufaulu. Tunaambiwa system imejaa. Na tukienda sana unakuta hiyo majina inaandikwa, lakini ile majina inaandikwa haieleweki hii majina inaandikwa ni wakina nani, kwa vile area mzima hakuna mtu mlemavu wa Nairobi anapata hiyo pesa.
The government has allocated 10 billion shillings for cash transfers to the vulnerable, the elderly and persons living with disabilities to cushion them during the COVID-19 pandemic. Eli Logova, TV47, Nairobi.
Well, we seek answers of that particular story and that one that Liz had raised earlier on KEMSA, of course, with our guest tonight. So keep it right here. It's important that you interact with us. Remember, #PledgeWatch. But let's cross over to the next story. And the Ministry of Education has released a raft of measures that will see students and pupils complete their syllabus within the scheduled time. The ministry, however, insists that the national examinations will go on as scheduled. Andrin Kilemi now reports.
I am focusing on the disease, not so much on going back to school.
In his response to questions raised by the Parliamentary Education Committee, Education Cabinet Secretary Professor George Magoha says the ministry has put in place a raft of measures that will see the education sector withstand and recover from the coronavirus pandemic. For instance, the CS says the second-term half-term holiday will be shortened by 4 days to allow learners have more study time. The otherwise month-long August holiday will be shortened by 2 weeks. School day time will also be adjusted to have longer hours, meaning more class time for learners. The Ministry of Education, however, insists that national examination dates will remain unchanged. On the modalities the ministry is using to educate learners while at home, the ministry says it has embarked on using both TV and radio to reach students, even those in the rural areas. The coronavirus pandemic has disrupted the education sector with more than 15 million students at home. 460 schools across the country are currently being used as quarantine facilities. Andrin Kilemi, TV47.
Thank you, Andrin, for that very story that will be taking us for a short breather, and we come back with the discussion. Remember, tonight, Murang'a Women Representative Sabina Chege is in the house, and we seek to get answers in regards to the preparation of COVID-19 right here in the country, now that she sits at the helm on the Parliamentary Health Committee, and what it is that they have discussed. We seek to understand in regards to ensuring that the country stays afloat. We take that breather. It's important that you interact with us. #PledgeWatch, and of course you can as well send us your messages on the short code running down on your screen, and as well on my Twitter handle, that is at Linda_Alela and at TV47. We take that breather and we'll be right back with much more.
more inquiries, please email ads@tv47.co.ke or simply call us on 0748 205 604.
Mount Kenya University takes pride in being an academic giant with some of the best infrastructure, imparting knowledge to the best brains in the country and the region. Our members of faculty are keen to deliver market-driven programs in science and humanities with a keen focus on linkages with relevant organizations. We admit both self-sponsored and government-sponsored students under the Kenya Universities and Colleges Central Placement Service. Join us today and train with the best to become the best. Mount Kenya University, unlocking infinite possibilities.
The coronavirus is spreading rapidly across the world, and currently there is no cure or vaccine against it. It spreads through tiny droplets when infected people speak, cough, or sneeze. These droplets can land on surfaces to be picked up by hands and are impossible to see with the naked eye. But just because you can't see them doesn't mean that they are not there. And you may get infected if you touch your face, nose, mouth, or eyes. To help stop the spread of the virus, we all need to do the 5. 1. Follow these steps to wash your hands frequently with soap and water for at least 40 seconds. 2. Cover your mouth with your bent elbow whenever you cough or sneeze. 3. Avoid touching your face. 4. Avoid crowded places. Keep a safe distance from other people. 5. Stay home if you can, especially if you have any of the symptoms. For more information, visit www.who.int.
This May on TV47, we are giving you more reason to stay at home.
You are the chosen one.
Because I am your mother.
Oh, that's pretty cool.
Same-sex attraction isn't completely gone because
my root is from God.
Oh, Pete.
Lazima round you utalipa.
You'll see some kind of like a smokish thing.
Hey man, don't forget about the monkeys.
Ni watoto ama ni kokoto?
Mama Saida, see you. Shut up.
Boy,
where are we?
Right here on TV47, the home of untold stories.
Hey, Sospita son. Tumefutwa wote.
Yawa, pia wewe.
Tumeachiliwa.
Si pia wewe unaweza anzisha biashara yako.
Na hii economy venye iko tough sana.
But not too tough for Mwananchi Credit.
Tutafanya aje?
Si niko na 5 good cars. We can get a quick logbook loan approved within 6 hours.
Nataka kuanzisha salon na spa. Hii haitatosa.
Si tuko na title deeds pay. We can still get more money using them. Get a quick approval within 6 hours using your logbook or title deed. Do not get stuck. Call Mwananchi Credit today. Si nilikwambia.
You are a big smart joke.
Mwananchi Credit. Investor in people.
Kila baada ya miaka 5 tunawachagua. Kwa kazi zao za ofisini tunawafahamu. Lakini je, unajua maisha yao zaidi ya ofisi?
Naomba Mungu kwamba ndio kabla hajaniokoa nikuwe bishop anipatie mpaka ile kipawa ile ya kuona ile ya ukweli, si ile vitu ambayo kinanganga wanafanya hapa ya ukora.
Milima na mabonde tutavuka, kaunti zote 47 na ikibidi nje ya nchi tutafika, ili mradi kuhakikisha kuwa umewafahamu.
Ile ningetaka kusema ni kwamba that vile tumelelewa tukiwa ndani ya biashara. Kwa hivyo biashara ilikuwa ndani yangu. Hii maneno ya kuandikwa ilikuwa tu formality kidogo upate laini.
Wale waliopo na wale waliokuwepo wote kwa mpigo tutawapata. Nitabisha, wakifungua nitaingia, kisha nitakupeleka kwa utaratibu katika safari yao ya maisha.
Kumbusho nioe 1992.
Nani alikukumbusha?
Ni mama alikuwa anatukasia sana, lazima vijana muoe.
Hayo yote utayapokea katika kipindi Mfahamu Kiongozi, nami Elizabeth Mutiku, kila siku ya Jumatano saa 2 kamili.
Now, many Kenyans still don't understand the role of women representatives in Kenya. A report that has once been tabled in the National Assembly and the Senate on whether to scrap off the positions as well as reduce the number of representation, raising an intense debate on the relevance of women representatives. Efforts to achieve the 2/3 gender rule have constantly been frustrated. And today, for the upbeat time, we ask, why is it so? Women, on the other hand, continue to suffer the predicaments associated with their gender. Sabina Wanjiru-Chege tells us what she has done and is still doing to address these challenges and much more. This is Pledge Watch. Welcome to the show. Once again, my name is Linda Alela. Interact with us, #Pledge Watch at Linda_Alela at TV47. Let's get to hear the questions that you have for Mheshimiwa this evening. Remember, it's a proper 30 minutes of your time where we get to ask all the questions that we'd be able to ask. Thank you so much, Mheshimiwa, for your time.
You're welcome.
Yes, good to have you this evening, and we go straight to it. CS Mutahi Kagwe was expected to appear before the committee on Monday. Sadly enough, this did not happen, but then we have been presented, or you have been presented by a report coming from the Ministry of Health in regards to how much prepared we are, and more so on the funds that were channeled towards addressing this. In your own capacity, do you suppose then that the money or the budget has been appropriately, first of all, allocated, distributed, and used?
Well, you said it right that CS was supposed to be up here on Monday, and they asked for more time. And today the accounting officer, who is the PS, appeared before us.
Right.
And she answered many questions that have been raised by the members of the committee, the members of the National Assembly, the public at large. And the main concern is about the COVID. And of course, we've had many concerns, especially the 1 billion World Bank money that came up. But today they were able to shed the light. And I think the problem that we have had is the communication. That's what I would say.
Right.
Because what we got from the ministry then, and this was something that was sent to the parliament on Wednesday, there was no explanation. But today a lot of money that was said to have been spent.
Right.
We were informed that the money has actually not been spent. And even the money, like for example, there was a lot of interest on the tea and snacks. That money has not even been touched, because we've had the hospitality industry giving food to the health workers who are helping in this time of the COVID.
Yeah.
And, you know, I personally visited Bagadi Hospital on Friday, on Labor Day, and actually witnessed it. That people like the Sarova are giving free meals to the health workers at the same time to the people who are actually at isolation.
Yeah.
There were many issues apart from there was the issue about the ambulances, which you were told for the 15 ambulances, and the cost was not just ambulances, actually being hired from Red Cross, and they came in as a pack with the personnel, with the what is required. Actually, 5 of them are like ICUs. They have all the equipment, and they have not just been hired for a month. It's just for the period of 3 months. And for us, we are pushing them to actually negotiate. That amount can cover for the whole year. As we prepare and ask ourselves, could we then have our own ambulances? We were informed that majority of the counties were not willing to give the ambulances for COVID cases. And the ones who actually have the ambulances, some of them are not even working. So this was a time of emergency, and they had to procure from AMREF, from Red Cross. And so today, the report was an eye-opener. It's a document that is going to be out there for the public. Tomorrow I'll be tabling the same document in the House so that people can be able to scrutinize it. But one of the things that we have seen is that there's a rush in the media to try and, politicize the whole fight against COVID. And it's good for people to know this is not about the government. It's not about the people. It's about all of us. All of us are affected. And the best thing we can do is just to make sure that we all work closely together.
Right.
But there's a mistake, we rectify. And where they need support or where we need support, everybody should come in. When we are told to stay at home, let it be because of us, not because we are doing it for the government or we are doing it for the police or we are doing it for so-and-so. It's the most important thing is for all of us to know that this is a pandemic that is affecting all of us, and we will only achieve fighting this pandemic if we work together.
Why is it always that we get the breakdown after, there's been a lot of alarm that has been raised, as opposed to Kenyans getting the breakdown prior to, all these processes? So at least we do not end up, with lots of speculations. For instance, right now as it stands, there's this speculation also coming from the government itself, or coming from the from the counties and the governors themselves, saying that cancer is the biggest challenge again to dealing with issues of COVID-19 and disbursement of funds as it stands. So, is there a way that we can actually get reports prior?
I think I would not say KEMSA is a challenge.
Yeah.
We know there's a law that was passed that the first stop or the shop to go, whether from the counties, you go to KEMSA. And this was because of the quality of the drugs and essential drugs that were required to be taken to the counties. And we had noted that initially counties would procure from anyone. Right. So there was no quality. People were not getting value for money. And it became a business. And this was a decision made to save a lot of money from the government because of the people's, because we are the taxpayers' money. At the end of the day, this is our money that is being used to procure. And when KEMSA procures, it procures in bulk. So that means then the cost is cheaper. And they don't make profit at all. Yeah. But the challenge has not been KEMSA because this challenge has been a global challenge. You remember there's a time that the flights were not coming, even the cargo flights. Yeah. So a lot of things that we were requiring, the PPEs, the masks and everything, the gloves, we had to rely on China and other countries to bring in. Today we also met with Kemri, and one of the challenges was even when the Jack Ma brought the testing kits, there are some reagents that were missing. So they had to wait again for these reagents to be brought. So everything slowed down. And so the easiest punching bag was KEMSA. Right. But where was KEMSA to procure these things? They had not procured in advance or they had not planned for COVID. And so their stocks went down. And KEMSA opened an emergency kind of procurement and said, anyone with these goods, bring them. Bring them. So there was no issue of the tender and the way the process was being followed because it was a time for emergency. But I think by now they are a little bit settled down. Right. And of course they started with the counties that were mainly affected. So the priority was Bagathi, Kenyatta University, Mombasa, Kilifi, Kwale. And so the counties that don't have actually any COVID case, they would not have made any sense to send PPEs. Where else? We need them in Kenyatta. We need them in Bagathi Hospital. We need them in Coast General Hospital. So the government had to make a decision that this is our priority areas. Yeah. They did the hot areas. And I think by now, this challenge is over. All right. But remember also the president had actually opened up and said, we will bend the law that you have to buy from KEMSA for the next 3 months. All right. So that the counties will be able to also procure, if possible. If they are able to get suppliers, that window is open for the next 3 months.
All right. Yeah. Then we would argue that the arguments or maybe complaints by the Council of Governors or maybe the governors would be misplaced as it now in regards to the same?
It's open.
All right.
Right now it's open.
Okay, well, speaking of that, then one would want to ask, looking at the past and not to focus much on it, do you suppose that corruption and cartelism, cases in the country has probably come on board again to hinder the progress that we're trying to make?
Well, we cannot rule out corruption, but at the same time, let us also be very keen. When we say there's corruption, let us be very specific on where the corruption was. Yeah. The issue of corruption in the ministry came about when that document came out and leaked to the media because the document was sent to us. We had not scrutinized it. Right. And there was no explanation on that document. Mm-hmm. And there was also a mistake with the people who prepared this document from the ministry. So this was a plan that was done for World Bank. A lot of things that had been highlighted there are not even the true picture of what was presented today. For example, if I look at the document that were given by the ministry, yes, I've said this issue of the ambulances, the 15 ambulances, they said the ambulances have consumable PPEs, professional, that is personal, so they are paramedics and emergency medical technicians, the fuel insurance and maintenance of all this. And actually they said they are still having further conversation with with Red Cross.
Right.
And this was meant for 6 months, not actually 3 months. And within the 6 months, who knows, maybe there was an extension that would have happened.
Yeah.
And because we also know Red Cross gets a lot of support from the government. Something else that was very interesting was accommodation of health workers, the call center, the communication. People were saying 70 million for what? They actually said this money, no funds had been spent so far.
Right.
And discussion on modality of utilizing the funds is still ongoing.
Yeah.
And the call center also, they said Safaricom now has come in.
Yes,
and so they are getting a lot of, and so no funds.
Yeah.
So for the call center, no funds have been done. The accommodation, they said the payment is ongoing. On the printing, they explained what was happening on the printing. Actually, payment is on process. So this was a budget anticipating everybody coming through our borders have to get the document. Unfortunately, we are very manual.
All right. So you are convinced that this is indeed a document that is worth, of course, explaining what, all this allocation was.
Yes, and especially let me highlight on the so-called tea and snacks, which today was presented as hospitality services. And Kenyans were like, how would you spend 4 million?
Right.
But they say the 4 million was for a period of 90 days. And say currently, and I'm reading that as per end of April, the proposed budget under the World Bank was not touched. And they said, because the Ministry of Tourism came up through hospitality industry and gave them, and said, so far, no single fund has been spent. But what came out to Kenyans? 4 million has been sent on tea and mandazi.
Yes.
So you see now, misinformation then, of course, Kenyans, one, we are hungry. The whole thing of Corona has brought a lot of stress.
Yeah.
And so when people are stressed, they have to get avenue to, get their stress out.
Let's overlook the stress aspect for a moment and look at a story that we have actually touched on today. And the President had actually given directives on the fact that vulnerable in the society are going to be awarded some funds. Today we've run a story where persons with disabilities are complaining that they have not seen a single cent from the government. What would you say about that? Are these people who are at angry lots?
Yes, the people with disability are part of the vulnerable. And doesn't mean that all people with disability need help. We have various categories. At the same time, we have women, we have children. Not everybody needs, if you would say everybody would be helped by the government, we cannot afford it.
Could you be having information of some of people who've been helped?
Well, that is through the Ministry of Labor. Right. And so a different committee is handling the labor issues. And today in the morning, the Labor Committee actually had now the minister coming in because we raised some of these questions. Apart from even the ones that are new, vulnerable, we have the older persons over 70 years.
Yeah.
Up to now, the government has not been able to cover all of them. And so that has been a big challenge. Some of them were even given the NHIF cards, and today they cannot access to healthcare.
Okay.
That card is useless till now. So we raised those issues last week in Parliament. And so the Minister for Labour today came, and I know the Chair of Labour and Social Services will table the report tomorrow in Parliament.
All right.
But this has been a major concern. And so not all persons with disability has been covered. Not all children who are orphan have been covered. So not all vulnerable groups, because the government says yes, we have this amount of money. Yeah. They use the structures through the provincial administration to the Nyumba Kumi, so that they can look at the most vulnerable. But mistakes are done. You will find that there was a very deserving case that was left out. But that doesn't mean that they will not be considered. Right. So for now, if there are those cases, I think I want to urge the Nyumba Kumi to forward these names, the assistant chiefs, the chiefs, so that we can be able to have a clear database on who we are looking at, so that as we budget, then we know we are budgeting for 10 people, we are budgeting for 100 or 1,000.
All right.
Yeah.
So as it stands today, do you suppose then that we are on track towards addressing this health-wise?
I'll say we have seen even the biggest economies. No one has managed 100%. At some point, we have seen the giant saying, we have left it to God.
Yeah.
So I would say so far, looking at our economy, looking at our challenges in the healthcare sector and everything else, we are doing well.
All right.
We are not the best.
Okay.
But we'll get there. But that doesn't mean that we should sit down and sit pretty. We should actually work hard. And today when we had the meeting with the ministry, I told them this is an opportunity for us. We have always been seeing the issue of universal health coverage. Yeah. So the because COVID-19 is not the only disease.
Yes.
It has actually now given Kenyans, and especially us who are there in the allocation of finances and oversight, a chance to scrutinize and see how is our healthcare in our counties. in the remote areas, even here in Kenyatta.
Mheshimiwa, speaking of your counties,
yes.
or our counties,
yes.
Health facility has been set in Murang'a County, your county, in 21 days. Does that show an underlying capacity that is not utilized in the country?
I think the COVID has also come to challenge us.
Yeah.
And we say most of the times, innovation comes when there is necessity is the mother of all innovation.
Yeah.
And so we have stayed in Murang'a for a long time. We didn't have an ICU.
Yeah.
But the COVID has made it happen for ICU to
in
to
21 days.
In 21 days. So for me, I'll be going to see the ICU. I've not managed to go and visit it because of the other issues that we're dealing with at the national level. But if I go there, I'll be looking at, could I also look for a ventilator or the oxygen or something? How can I complement what my governor has done? So I wouldn't want to criticize it. I would want to support him and to tell him, no, Governor Murang'a, Mwangweria, you've seen you have the capacity. So there is a lot that we can be able to do together, and that's the spirit. Let's encourage the ones who are making efforts. I've seen governors who are, like Joho or others, being criticized, saying don't come and talk down on us, I don't know, do what. Yeah. It's not about him, it's about all of us. Yeah. And so if Murang'a County has been able to make a big ICU 31 bed capacity, which has a capacity of even 35 bed capacity in 21 days, that means we have the potential, it is possible, let us not sleep now. So COVID will not only sort the COVID issues, but the universal health coverage, because with UHC, what do we look at? Yeah. It is affordability of our health services, access, of our health services, and quality health services. So because we can have buildings, but are we getting the right services that are required? Yeah. It has been an opportunity also. We have been saying we have shortage of health workers. So this time we have 1 billion to hire our health workers. Though they are saying the contract is for 1 year, I would really urge the government.
Some of them threatening to strike.
Exactly. Right. So we have had lessons to learn. So let's not just look at the negative side of the COVID and the stress it has caused us, but it has also opened up new opportunities.
In the wake of another pandemic, would we be in a better position to deal with it?
I think so. Right. I think so, because once bitten, twice shy. So it's important that now, and especially we in the health. In the health sector.
Just trying to read a message
and open our eyes.
Yes, just trying to read a message from one Wafula, and this is what he asks. Well, 6 people dead, that is according to him, so far because of COVID-19. In the event that hunger strikes, it is probably likely to kill more. What measures are being put to ensure that we deal with this?
Through social support, but I also want to say something here. We still had people who didn't have an opportunity or job opportunities when there was no COVID. COVID has been here with us for, let's say, almost 3 months now, 2 months. Yeah. So as a nation, we need to reflect and ask ourselves, what can we do to empower our own people? Right. We have been talking about manufacturing, industrialization, like it's something that is so far-fetched. But when the COVID came, we've seen our local manufacturers doing the masks. Yeah. We have seen our young people say we can even make ventilators. So there are many people who have also gotten an opportunity through COVID. So let us not just ask what is going to be done for us, because I can stay in the house and say, fine, there's nothing I can be able to do. Right. But let us now use our creativity. And I want to emphasize on Buy Kenya, Build Kenya. Right. I want to emphasize that we don't have to wait for masks to come from China, which is this material that they use. We have our researchers, we're in the university. So it's the high time now the government goes back to the drawing board and asks, how much are we investing in our universities, in our research? Or have our universities become just a production of many graduates every year, or after every few months? And then but they have nothing to bring to the job market. So let us start training. We look at what are the needs and the gaps in Kenya and train people who can be able to come in and bridge the gap. But currently, unfortunately, we have very many degrees that mean nothing. And that's why if today you go out in the job market, somebody will tell you, I have a first degree, I have a master's, I've never gotten a job. Yeah. So let us prepare our graduates to become employers, not wait to be employed. Okay. And I think that's a challenge that COVID has brought, because COVID will come and go. But at the end of the day, we must be able to sit down and have a proper strategy for this nation. Right. Let us have a conversation with our universities. We have all seen now our children, they don't have to go to school. So which opportunities are there that we can be able to even have access to school, to children going to school? Yeah. They don't have to be to physically go. And we have seen it is possible. It is possible. So is it our network? Is it trying to, do the village satellites? what can we be able to do? Because even if the Ministry of Education today they have said they're doing radio programs and TV.
Yeah.
But how many homesteads in our villages don't have radio, TV?
Lots
so what
of
will happen to
complaints.
those children?
Yeah.
Are they children of a lesser God?
No.
So we must come up with a solution. And this is the time for researchers and the people to think and say, this is an opportunity for Kenya to support itself. Let us not wait for China or other countries to come and bring solutions to us.
Okay, without delving much into that and into a question that is going to, direct us to the interest of women as it stands today. You've talked about education. We're looking forward to see women getting a fair share level of education. But most importantly, during this time of COVID-19, reports coming that indeed women are not in the best of state, especially now that we are all at home and, gender-based violence on the rise and so much. So what has been done towards ensuring that we create a safe space for the women, especially at this time?
One of the things that I can point out is the issue of the opportunity that has come for women groups. When the masks were being done, there are some members of parliament who are buying materials or even buying from those women groups. Myself, I'll be going to Murang'a on Thursday.
Yeah.
The cloth face masks, I'm going to procure them from the women in Murang'a County and the young people who are making them. And so the challenge with women is that women, when the children are affected, when the children are at home, women are the ones who are left taking care of these children.
Yeah.
Majority of them, especially in informal sectors, you'll find that they go wash clothes. And now the restriction of you can't come to my house, so now I'm at home, so I'll wash my own clothes and I'll not need that person, has been a very big challenge for women. But I was well saying there are many opportunities will come up. But we must focus on how we can be able to, if we have the children, we have helped the women.
Right.
If you open up, and I think that's what the government did it in good faith, that has turned out to be a bit sensitive now, opening the hotel sector. Because a lot of people who work in the hospitality industry are also women. But what has happened, so Mutai, I heard him today saying, we are opening people eating 2 sausages and having a drink. So the problem was, is the problem having a drink? Is the problem eating 2 sausages? Or really, what is the problem? What's the problem?
Right, and that's exactly what Kenyans are asking.
Exactly. So the issue of the government deciding or making a decision to open restaurant, I know it was just filling for the people who were earning from that sector. And majority of them either will be given a commission or will be paid by the many days that you work. So with this COVID and when the restaurants were closed, they didn't have anywhere to go. And that was one of the opportunities that the government thought would open. But let's also look at the risky part of it.
Right.
We might create an opportunity for people to go to work, but put them at risk. So this must be well thought. And today I had the ministry and we were asking about testing. So only now 10 counties have the capacity to test. So what does that mean then for the hospitality workers who are also in the other 27 counties.
Right.
Or there are actually like 7 counties. So there are still gaps, but I say we are learning.
Right.
This is something that was not expected. And as the ministry also today, they said when it came in, people tried their best.
Right.
But now it is at high time that we come together and now have a proper strategy because this COVID can be here for a long time or even for a short time. We never know for how long that COVID is going to be with us.
All right, before we discuss issues to do with women, let's first of all take this story that will be taking us for a breather, and we'll be coming back with much more. And Wajir County's COVID-19 positive cases have reached 7 after 5 more cases were reported today. Now, the 7 COVID-19 positive patients contracted the disease from the neighboring country, Somalia, after they crossed the border to sell their livestock. And of course, as reporter Isadine Haji reports more in regards to this, and cross-border pastoralism could escalate the number of coronavirus infections in the northeastern in the event that this is not looked into.
As the country's total number of confirmed COVID-19 positive cases rise past 500 mark, Wajir County has registered 5 more positive cases, bringing the total number in the county to 7. In the past 24 hours, the county had tested 9 samples at the regional referral laboratory, and only 4 samples turned out negative.
The long porous border with Somalia is now the new front of infections in our country.
Panic has gripped Wajir County after 5 more cases of the highly contagious coronavirus were reported in the county border Somalia. The porous nature of the border and public defiance are not making the situation any better. So far, 30 people are in different quarantine centers in Wajir, with most of them being pastoralis picked up along the Kenyan border with Somalia.
Our efforts bore fruits and we intercepted more individuals sneaking back into our country, and the contacts of the earlier ones.
The greatest worry for the county now is the long border with Somalia, as the 7 positive cases are as a result of cross-border migrations. Wajir town is just over 100 kilometers away from the border of Somalia, hence making it difficult for the county to deal with pastoral movements between the two countries. Pastoralists from northeastern region often travel to Mogadishu for livestock trade, and this is another major challenge since Somalia is equally ravaged by COVID-19.
But our security agencies will be vigilant along the borderline and ensure that interceptions and roadblocks are placed in strategic areas. But what is more critical ni wananchi kuvolunteer information. Hiyo tu.
Wajir's neighboring county to the north, Mandera, is now under lockdown following confirmation of 8 positive cases of COVID-19. With Wajir County's COVID-19 cases now standing at 8, similar measures or worse could be taken in order to slow the spread of the virus.
If in the next couple of days the situation continues as it is now, then there is a likelihood of us being put under the same lockdown.
Even as the spread of the virus in the county is blamed at pastoralists crossing to the neighboring country of Somalia, the bigger question is how many more livestock traders could have found their way in without getting noticed and probably carrying the virus. Isuddin Haji, TV47, Wajir County.
Well, and in the best interest of time, we're not going to take that breather. We'll come back to you, Mheshimiwa, because then again, there's so much to discuss and time is moving pretty fast. And we cross over to the issue of the women. Like I had said earlier on, I mean, many Kenyans view the women representative seat as a mere flower, girls, while others say that women representatives are a wastage of taxpayers' money. Being amongst the pioneers, do you think this statement is justified?
Not at all. And it's sad because with the work that women reps have done in this country, I think the first thing, that position was not supposed to be called women rep. Right. Because we are county women MPs.
Yes.
We are a normal MP like any other. Let's begin from there.
Yeah.
And my work is even harder because I represent 7 constituencies in Murang'a County, whereas a normal MP represents 1.
Before you even delve deep into that,
yes,
I would want to ask, are there times that you felt like it would be the best of interest for you to be elected based on your ideologies as opposed to the fact that you are a woman?
I was not elected because I was a woman, because we are other women.
But this is a position whereby it's about women, yeah, all right?
The only thing that happened with the position of the woman MP was to have a person who represents the county, like the same thing we have a senator.
Right.
A senator can be a woman or a man. The MP can be a woman or a man. The governor can be a woman or a man. But because of the African, and I will not say Kenyan, women were not generally accepted to be in the leadership position. And there was this general feeling that women belong to the kitchen.
But they've been given a chance to prove themselves.
That is it.
Do you suppose as pioneers you did not prove yourself enough?
We did. How come I came back?
All right. Well,
exactly. And we came back 11 of us, not just myself.
Let's pick this
and
one.
Looking at the numbers of even the members of parliament who come back, I think the women reps did very well.
Let's pick this phone call and then come back to you, Mheshimiwa.
Yeah.
Wafula, good evening. Good evening, Wafula.
Yes, good evening.
Thank you so much for calling in. Mheshimiwa is here listening to you, yes.
Okay. And my first question, Mheshimiwa,
yes,
is that we have seen lockdown in Spain, we have seen lockdown in Italy, and even in our neighboring country, Uganda.
Right.
So, are they imagining that they are also expecting lockdown? Because what is happening, wamefungia tu watu Nairobi, lakini watu wakiamka asubuhi wanakutana na kama kawaida. So, if 42 billion ambayo wanasema waziri anaspendi kwa mambo ya ambulances, it is not reasonable. Because hiyo pesa inatosha kutumia watu hapa Nairobi, Mombasa na hizo counties zenye ziko affected na wakae kwa nyumba for 14 days so that we are able to contain this disease or combat this successful.
Okay.
So mimi nauliza kama wanasiasa wala wanafaa watetee wananchi wa kawaida,
ndio
wanafanya juhudi gani kuhakikisha kwamba the government do the necessary to ensure that the COVID does not spread across the country.
Okay.
Alafu swali lingine bila kusahau,
briefly,
tumeona ile county watu wanasema wanakombati COVID at county level.
Right.
Watu wametake advantage of this situation, they are looting our money. How are they planning to ensure that and protect our resources, because people are going to loot our money in the name of combating COVID.
Right.
Na tuna expect hii president anafaa kuwa ametengeneza task force.
Okay.
So that we fight this at the national level to concentrate resources where necessary. Lakini ile pesa ambayo walipata inatosha kutumia watu kwa pesa na wakae kwa nyumba at least for 14 days.
Okay.
Alafu watu warudi job. Now, if they can't do that,
yes,
they should allow people to go back to work, because staying at home and the morning you are meeting with other people, that's not relevant.
All right.
So, mweleze atuambie juhudi gani hao wanafanya kama wanasiasa. Unajua tumekuwa na wanasiasa ambao wanapita.
Asante Wafula. Asante sana. Mheshimiwa, the questions are there for you.
Decision, and Wafula said if the 42 million can be sent to people, they will say, yeah, if you look at Nairobi, the population is almost at 4 million.
4
Let's
million.
even say we'll target 2 million. That means maybe around 21 shillings per family. I don't think it will make sense. And the decision to lock down or not lock down is a decision made by the executive. But looking at it, lockdown would work for the middle class, because you might be able to have unga and stay, in the house for a few days. But there are people who live, through hand to mouth, and they have to go out and come back. Why was the decision to lock down Nairobi, or to lock down Nairobi, Mombasa, Kilifi? Because these were the red areas.
Right.
And if you look at us locking down Nairobi, or the government locking down Nairobi, we made sure that people are not taking the disease to the villages. And I think it has been noted.
But the numbers are going up, Mheshimiwa.
Not in the villages.
Okay.
The numbers are going here.
But now we have new cases in the counties.
Exactly, but if you look at the numbers,
initially, yes,
it is Nairobi, it is Mombasa. And there have been obvious cases where people are told to wear a mask, where people are told to keep distancing. You've seen even when the Muslims are doing their evening meal,
right?
That they are still mingling. And the worst case with this disease is that a lot of people are not showing any symptoms. And so you'll sit with your friends, and because no one is coughing, no one has a high fever, no one has a sore throat, then you assume that we are safe. Okay. That has been the challenge of this disease. But God has been, let me just say that God has been great to us as Kenyans, and maybe even to a larger extent as Africans, because this disease has not hit us as it has hit the other countries. And it's a disease that scientists are still researching about it, because it's unknown. And it is important that maybe at some point the government might decide we'll do a lockdown for 14 days so that then they can do mass testing. Because you can't just say lockdown without a definite date. Up to when? Yeah. Till today when we met with Kemri, they were saying they're still struggling to get the testing kits. So even at the targeted areas, they don't have enough testing kits. Okay. So what are we locking people down to do? And I said it's a decision that is going to be made by the government, but I would want to encourage people for now. And I said it's about all of us. If you adhere to the rules and regulations. Today I saw in the news in the evening, people are queuing like back to normal in the matatus. They're no longer keeping social distances. So let us take it as our own responsibility.
And even the officials conducting mass testing equally, there's been issues raised. I mean, don't we have PPEs, enough PPEs for them? Because
I think 4 PPEs are there now.
Because someone is using the same glove to almost like test 3-4 people, take sword samples for like 2, 3, 4, 5 people.
Yeah, but it depends, because when that sample, if you're looking at it how they are taking the sample, if they do the nose and if they do the mouth, there's nowhere they are touching, because that thing is a long thing. I have already done the test myself.
Okay.
So it's not something that you're That is our work.
I'll definitely get them and forward them to you accordingly. Thank you so much, Sabina Chege. That is the women representative of Murang'a County and equally the chair or the head, the health committee in Parliament. It was great having you and thank you so much for your feedback back at home. Sadly, we might not be able to go through all of them, but all the same, we say thank you so much. I hope some of the issues that you'd have wanted addressed have certainly been addressed by Mheshimiwa. Until next Tuesday, do enjoy the rest of your viewing. My name is Linda Alela, the sign language interpreter, and Wailimo.